Hey guys, it's Kat and Mel. Here's Mel. She's about to do my face. I'm gonna get my face dermaplaning today so you guys can see how it's done, and we'll talk about the benefits and the reasons why you do it. So far she has washed my face, so I only have mascara on, but she's cleansed my face with a skin brightener, and then we're about to get started and she'll tell you a little bit about the process as you guys watch it.
Okay, so what we're going to do is we're going to dermaplane. Dermaplane is done mechanically. It's not done with a machine. It's done with this tool that actually has a blade on the end. I don't know if you can see it. Yep, you can. That what it's going to do is I'm going to scrape it on her skin, and I'm going to remove dead skin cells, the vellous hair. It's a great treatment to exfoliate. Some of you know what a microdermabrasion is. It's similar to that, but this actually is a little bit better, done mechanically. It's great to remove all of the dirt and different things that get on your skin. It just does the epidermis, so it's not going to go any deeper than that. It provides immediate skin tightening and collagen production, so everybody wants that. Tighter skin, that's great. Helps your skin to look younger, more vibrant and bright. And the one thing I want to say is I hear this a lot: is my hair going to grow back darker or thicker? No, it will not. It will grow back exactly the same thing. Your hair growth cycle is a month, so in a month, if you don't get the treatment again, you will have just exactly the same little peach fuzz or vellus hair that you had previously.
Awesome. Let's do it.
Okay, you ready?
Yeah.
Okay, so I'm going to have you turn this way a little bit, and I will begin. But before you start, you have to put gloves on.
So it was one thing to look for, like this blade that you used on me. You pulled it. I watched you pull it out of a sanitary packet. Is it a one-time use blade?
It's a one-time use blade. You never reuse the blade.
So make sure if you're going to get it done that you see your technician pulling it out of a sterile packed.
Yep. You only want to use them once. And there's really, this is the type of treatment that you can get, and you can actually go back to work or, you know, continue on your day. The only thing you don't want to do, as in any treatment that you do cosmetically on your face, if you're doing any pills or anything like that, you need to avoid exercise for 24 hours.
And probably, I shouldn't go out and sunbathe today either.
No, you should not. And you can kind of see, I don't know if you can see that, but
Do here, let me see that. Can I hold this? Or is
Yeah.
that going to ruin it since I don't have gloves? Can you guys see that? There. Gross.
Yeah.
That's like the world's smallest area
yeah, so that's her vellus hair, and
on
then
my
some,
hairy face.
and some dead skin cells in there. So we're just going to put it
So
right
that's
there.
what they're taking off.
When you do this treatment, you want to make sure that you hold your blade at an angle so that I'm just scraping, I'm not cutting. You don't want to cut at all.
The other thing I know is that it helps to, dermaplaning helps to put your product on smoother. It helps you to save face product, right?
Yeah, there's a couple things that are actually great with this treatment also, is since you are going to be removing all your vellus hair, when you put on your makeup's going to go on smoother. And then also removing all the vellus hair and the dead skin cells helps the serums, if you're going to use any type of a serum, vitamin A, vitamin C, it helps to penetrate a little bit deeper because it doesn't have to go through or try to go through any type of the hair or the dead skin cells. Sometimes having a layer of dead skin cells prevents any type of serums that you're putting on your skin to penetrate, to do, you know, the good that you need it to do, to get down to the collagen and, or, you know, down into your epidermis at all. So what we'll do with her, because she does have some, she has a little bit of melasma. She's had a baby, and so she has the melasma mask a little bit. It actually has lightened.
I've been taking some supplements, and I'm using kojic acid a lot too.
Which is really great. The cleanser that I used had kojic acid in it. So anyway.
Did I interrupt your thought?
Yes, you did. So if we use a vitamin C serum, which what we're going to use is Pro Heal is clinical. It has actually L-ascorbic acid in it. It's a great product. It's a serum. So I'm going to apply that after this, and it will be able to penetrate a little bit deeper and get in to help with those, to help lighten the melanocytes. Or actually, melasma is caused from hormones, so that's why sometimes they refer to it as the pregnancy mask. Probably don't want to know that.
I have a cute baby boy. He's 4 months old, so they said, though, didn't they say that the myth is little boys are supposed to make you more beautiful?
Yes.
Not true.
It's working.
No. Melanie's making me more beautiful. So do you do all over the face?
You do. You do all over, because, you know, you've got your dead skin cells everywhere. You have some closed comedones right there, but maybe that will help get rid of those, get rid of the dead skin on top so that we can extract them. Okay, I'm going to have you turn a little bit this way so we can make sure we get this whole area.
Also, if anyone's interested in getting it done, this does not hurt at all. It's just kind of a light scraping. There's no numbing cream. It's just a surface treatment. So you shouldn't be in pain, and there's no reason to be scared of this treatment either. There's pretty much zero risk in getting it done. I mean, as long as you have someone who knows what they're doing. There shouldn't be any cuts, and there's no permanent, like, long-lasting effects like some other treatments. But this is a really great, wouldn't you say this is a really great procedure to kind of jump into the whole aesthetics world and
I think
pampering?
so.
It's pampering, and it's beneficial, but I know that some people are a little bit scared to jump into more than just washing their face at home.
Yeah, I think sometimes when it's always scary for some people when they hear the word chemical pill. And I think sometimes what people don't realize that there's a lot of different kinds of chemical pills, and a lot depends on the percentage of acid that's in the chemical pill. But since this one is, there's nothing like that involved. It's just...
We just washed my face and now you're exfoliating, yeah?
Yeah, we're just getting rid of all the debris and dead skin cells and the vellous hair. So her complexion will look brighter. And then we're also at the same time stimulating, like I said before, the collagen and elastins to help tighten, which everybody wants.
You know, well, I love this process, and microneedling, because I try to avoid wearing too much makeup. So I love that you can just make my skin brighter and by itself. I am a mascara and lipstick girl, and out the door.
That's perfect. This is the perfect treatment for you then.
The courses that are a series,
and you can kind of see my little line.
Do you see all my little hairs still?
Yeah, I like to keep it there, and then I take it off after, then I can see where I've gone. You don't want to take off the eyebrows.
No, keep my eyebrows. I've worked so hard to grow them in.
And of course, you don't go over any type of moles or birthmarks or whatever you want to call that.
I don't know.
We'll call it a beauty mark.
Perfect. If there's like, if it's a, like kind of, if it's not super raised, can you go over it, or you just have to be careful about it, or?
Well, yeah, you can go over
Okay.
it like this right here. You have some hyperpigmentation right there. It's not going to hurt at all to go over that. Sometimes going over that, it helps get rid of dead skin cells on top, and it can help lighten it, you know.
Perfect.
So,
Also, I know that a lot of times people are wondering about the frequency. So we say to do this about once a month. Is that because of the cellular turnover?
it's a combination of both. It's the cellular turnover, which takes about, well, it takes about 50 days for the cellular turnover. But the vellus hair on your face is, there's a month. It's 30 days that your hair, the turnover of your hair.
So 4 to 6 weeks, having it scheduled between there is a pretty good.
Yep. Now, the thing with the cellular turnover, I've heard a couple of different days that it takes, the amount of days that it takes. I've heard 30, and then as 30 days to a month, and then as you age, you add time on, because the older we get, the slower the cellular turnover gets. And that's why sometimes you'll see more mature skin that looks a little bit dull and almost, you know, kind of has a gray tint to it, and that's just layers of dead skin cells that's on there. And so, you know, the different amounts I've heard of the days, I would say, because I've heard 30 and I've heard 50, so I'm going to say between 30 and 50. That way we're covered.
Perfect. All right, so you guys kind of have the drift of what dermaplaning looks like and the benefits of it, and then we'll be putting the Is Clinical Pro Health
Pro Heal.
Pro Heal on after to just kind of finish up this treatment and
That's going to be our serum.
use that to keep fixing my skin. So thanks for watching.